If I was treating myself, I would definitely spend money on Botox, biostimulators like Sculptura, Radiesse, definitely certain lasers that would fit me, and routine skincare. That's all worth it for me. I think Botox, Dysport, neurotoxins, I think it's worth it if you're going to start treating, you want to maintain because you're going to get rid of your lines and wrinkles. You don't want to just correct it, but you want to maintain it, keep it going, and that'll keep you looking youthful for a long time. I think lasers like BBL and Moxie are definitely worth it. It's the same thing. You want to correct your pigment, you want to correct tone, texture, and pores and all the things. Once you correct it, you want to maintain it. So you're not going to do a BBL Moxie once. You're not going to fix what you have wrong once. You want to fix it. You want to maintain it. Keep it going. Combine that with treatments like Botox, Dysport. That's the best way to maintain results. For BBL and Moxie, typically we recommend 3 treatments. That would be for the corrective phase. Once you're done correcting your issues, you definitely want to quarterly maintain by doing a BBL and Moxie with a different protocol that's for maintenance throughout the year. Resurfacing lasers are targeting something a little bit different. You are targeting some of the pigment as well, but you want to get a little deeper. You want some collagen stimulation with fractional ablative lasers. You want to treat fine lines and wrinkles that are deeper, etched in wrinkles with resurfacing lasers that are full field ablative lasers. People call that a CO2 laser. That's one technology. Erbium is another technology that will resurface. These are really good treatment options for those who need those treatments. I love microneedling for acne scarring. That's one technique to treat acne scarring. It's a very gentle way to treat scarring. There's very little downtime. It does take multiple sessions to see results. However, there are other options for acne scarring, erbium fractionated lasers like fractional, but I do like microneedling monthly for people who have acne scarring. It just will take a little bit longer. Microneedling has lots of other benefits. You're making multiple little channels into the skin, and that's stimulating the dermal layer of the skin where our fibroblasts live. You're forming collagen, you're helping to break up and reduce pigment, we're reducing scarring, we're tightening pores. We can use all sorts of skin boosters on top of that to cut into the channels and put in things like PDRN, polynucleotides, and polydeoxyribonucleotides, which is salmon DNA. These things all help boost what the effects we're looking for from the microneedling procedure. Love Sculptura, I love collagen biostimulators, I love treatments that are going to give natural results. Sculptura is going to stimulate those same fibroblasts in the skin. They're going to give natural results a little more slowly, but it's your skin producing its own collagen. It's yours to keep for as long as you're going to keep it. And Sculptura is a great correct and maintain treatment also. Everything again, correct the volume, correct the laxity, give yourself a glow with Sculptura, and once you got it, maintain it. Don't leave it alone. Hyaluronic acid fillers are still great. You have to use it in the right setting. You don't want to just grab hyaluronic acid fillers like Juvederm and Restylane and say that's what I'm going to use all the time. You want to use it in the right patient population. You want to use it for the right treatment areas. You want to use it in combination with things like Sculptura and Botox, Dysport, neurotoxins. So combine your collagen biostimulators with your dermal fillers, with your neurotoxins. Make sure you're treating the right things. Make sure you're choosing the right treatments. Correct them and maintain them. I love PDO thread lifts also, specifically in the right patient population. It definitely can give you a very mild to moderate lift. It's very easy to do. There's very little downtime. We do see great effects. We do give the number of threads that are needed to obtain the result that that patient needs. It's not a facelift. It's not going to give you a tremendous lift that you would expect from a facelift. We do have to manage expectations always. We do want to show the patients before what they might expect, and we do tell them to expect to have to repeat it every year. So for skincare, you have to choose a medical grade skincare line. You have to choose from that line the products that you really believe in, that you quality, percent of the active ingredient, that it's tried and true. You want to go by a protocol. You don't want to just choose random things from a medical grade skincare line. You want to have a goal. You want to correct the target that you're trying to correct, whether it's pigment or redness or acne or general anti-aging. You want to get there, and then you want to continue to maintain it. So I do like medical grade skincare. We have to check, we have to make sure we're using the right products on the right people and continue. I'd be cautious spending money on things that are trends, that are not tried and true, that we don't have evidence on yet. Things are coming out all the time, and we're hearing about all these amazing things we're seeing on Instagram, but we just don't have the evidence yet. So I'd be very careful following things that we're seeing on Instagram and TikTok without real evidence that they work. The easiest way to avoid wasting money is going to somebody who does not have an accurate, a specific treatment plan for you. You have to have a treatment plan. You have to have a full consultation. You have to go to a provider that's going to provide that for you. It has to be comprehensive. It has to start with a holistic view of you. You want to look at the skin. You want to look from the top down. You want to look deeper. You want to look subdermal. You want to look at the fat component. You want to look at the muscles. You want to look at the bony structures. You want to look at everything, and you want to come up with a plan over the course of the next year to 5 that's going to work for you. And what's going to work for you is not necessarily going to work for the next person. So make sure it's personalized. Make sure it makes sense to you. It has to fit into your budget. It has to make sense. Commit to it and stay with it. If you don't stay with it, it's not going to be worth it. We love doing these consultations here. We use our Aura Skin Analysis device, which starts with looking at the holistic view, breaking everything down. We sit with you, we talk with you, and we love seeing new patients. So when you come see us at Youthology, we're going to provide that for you. We'd love to see you.